From the beginning of this virus, there's been confusion over testing. Harvard says we need to do 5 million tests, but others say that number's unrealistic. We've only done 6 million tests since this all began. In your opinion, how many tests do you think we need to start opening up the country?
So it's all about testing, testing, testing. You know, there have been a number of different numbers floating around. I've heard 10 to 20 million a day. In reality, we've been doing about 150,000 a day. As you can tell, there's a huge gap in what's happening and what needs to be done. So rather than focusing on just testing, I think we need to definitely improve testing, which I can tell you has been happening more and more in the past couple of weeks. But we also need to couple that with other initiatives, such as having the healthcare professionals trying to do contact tracing and identifying those that have the disease and isolating them. So I think we need to do a number of different things, not just the testing.
Oh, so, Doctor, some states like Georgia, Texas, Colorado, they're reopening this week. Do you think it's too early? And what do you think the damage is going to be?
So I really think it's too early to open the states. And part of the reason is, you know, I just talked about earlier about testing. We are not at full capacity for testing. We've also not implemented enough steps to do the contact tracing and isolating the individuals that have the disease. Also, if we open too early, we run the risk of having another surge. And are we prepared to deal with another surge? You know, does the hospital have enough supplies? Is there enough PPE for the staff? Do we have enough staff? You know, what are our treatment options? You know, have we worked out all the details? Have we set up things in place for businesses to get back into the new norm? There's still a number of things that have not been done. And so early in opening right now is going to be a little bit premature, I think.
Dr. Wiles, yesterday, Dr. Fauci announced promising results from the drug Remdesivir, that it shortened the symptom period in patients, but a Chinese study, a study from China, showed it did not help people recover faster. Should we be hopeful about this drug?
I have to tell you, I'm excited. You know, we have been working on the front lines with a lot of different experimental drugs, not really knowing what we are trying, what we're treating. And so having some ray of hope, having Remdesivir as showing some positive results, granted they're preliminary, but it shows it shortens the duration of symptoms, which a day makes a difference. And also it decreases the mortality rate, which, you know, we know more studies need to be done, but I think it's definitely a step in the right direction. And any ray of hope is very hopeful for all of us on the front lines. The study in China, I think we'll have to look at that more, but I think there will definitely be more analysis of the data from the study from the NIH, and that will give us more information. Moreover, we're also using other therapies which need to be evaluated too, which will even add more to the armamentarium of things that we're trying to use to treat these very sick patients.
Well, doctor, we're also hearing a lot about antibodies, and Dr. Fauci has said, quote, there's a reasonable assumption that when you have an antibody, you are protected against reinfection. But the White House has said there is currently no evidence that people who have antibodies are protected. So do antibodies provide immunity to this virus?
In general, you know, when you have antibodies, you do have immunity. You know, the question is, how long does it last? There's still some unknown questions, especially with COVID-19, because it's a new virus. So there's a lot of unknowns. And, you know, we try to look at other viruses, other infections to see how they operate. And what we don't want to do, especially with COVID-19, is to assume it's going to behave the same way. So we're trying to make sure that we have enough data before we make these assumptions.
So So I was about to go get an antibody test yesterday, but somebody in the medical fields advised me not to go. He said it's only 3 out of 14 antibody tests delivered reliable results. And it wasn't worth the risk of my going into an urgent care facility, for example, a risk to my health, to bother with the antibody test. So what do you say to that? Only, what did I say, 3 out of 14 give you an accurate result. Is it worth it to go and bother with this?
A great question. First of all, let me just tell everyone what an antibody test is where you get a blood test and they measure the antibodies in your blood to see whether or not you have had the infection and have recovered. And usually those antibodies take weeks and days to weeks before you see them showing up in the blood. Now, I have to tell you, the tests have really not been very reliable. There's been problems with the quality of the results. And as you can imagine, for physicians like myself, it makes it really difficult. So, there's a lot of work that needs to be done to validate these tests. So I think right now, until that process gets worked out, I think it's reasonable to hold off on the antibody test. But I want to make sure I encourage you to continue to practice the things we're talking about. Social distancing, make sure you wash your hands, make sure you wear the face cloth or mask when you're out in public. Because if we can't test the result, if we can't trust the results, I think we need to use other measures to ensure that we're not spreading the disease.
Now, Doctor, a new report from the CDC found that more than 80% of hospitalized COVID-19 patients in Georgia were African Americans. Why do you think that's the case, and what can be done to get more help to the African American community?
Yeah, one of the things is that COVID has exposed the health disparity in the Black and Brown community. I mean, it really has been heartbreaking to hear the stories of what's been happening to minorities. One of the things that we have found was that there wasn't a lot of data that was being published early, which creates a lot of concern because had we known some of the information earlier, we might have been able to do more sooner. What we find in the African American community is that there is a lack of information and education, and I think we need to try to address that even sooner. Also, African Americans tend to have a lot of underlying health conditions which sometimes don't get addressed as soon as we would like. And so when you have underlying conditions and then you have other illnesses on top of that, you can imagine that things are definitely worse. And also, they tend to go to the hospital a little later. They put it off. And when they go, they're so sick that it is harder to get them better sooner. So, those are just some of the things that we have to deal with. And, we're going to have to try to change the equation. We're going to have to now start working in these communities to make sure that
Dr. Simone,
Yes?
Dr. Simone, we have to go, but I want you to know at any point you can come back to The View. We love talking to you.